Hey, what's up world? It's Dr. Kels coming to you live from Fit Club Williamsburg. On today's episode of the Injured Reserve, we are going to go over superstar point guard Ja Morant. Ja just recently had a grade 2 sprain of his ankle. So today we're going to cover ankle injuries and ankle sprains. We will cover in this video the different grades of ankle sprains. We will go over and compare the differences between lateral ankle sprain and a high ankle sprain. We will talk about some of the activities that you need to be doing in your early stage rehab, and it will also just highlight the importance of the ankle stability and the ankle ligaments so our athletes can get back to doing their thing. All right, guys, so we have 3 different grades of ankle sprains: grade 1, grade 2, grade 3. Grade 3 is the most severe. Grade 1 is the best or the least severe with the best prognosis. So think of your tendon, right? Grade 1 is just going to be a little lengthening added to that tendon, right? That's going to be our least severe injury. Is a grade 1 sprain. There's some micro tears that might happen at the ligament level, but it's mostly stretching of the ligament. That's grade 1. Grade 2, we have more severe tearing. It can be halfway torn, a quarter torn. So there's definitely some tearing that happens, at the ligament, but it is not a complete tear. Grade 3 is where we classify our complete tears of those ligaments, and typically that's when surgical intervention is needed. When you talk about high ankle sprain versus a lateral ankle sprain, your lateral ankle sprain is more exactly that. It's going to affect the ankle joint. It's going to affect the talus, the mortise, the calcaneus, the navicular. All of those are bones that make up that foot and ankle joint. Our high ankle sprain actually is more of a lower leg injury. That's going to affect the tibia, the fibula, essentially the interosseous membrane, which is soft tissue that lines those 2 weight-bearing joints of that lower leg, or the one weight-bearing mostly in the tibia and the non-weight-bearing in the fibula. But a high ankle sprain is actually more of a lower leg injury, not as much as an ankle injury as opposed to a lateral ankle sprain where we come and fall on the ground or trip from jumping or landing or running. So next, what we're going to go over is some of the things that we want to make sure that our athletes and patients are doing as part of their early stage rehab. Number 1, we want to make sure that we're getting mobility to the joint, right? What we don't want is for there to be abnormal stiffness following injury. So introducing mobility early in a controlled manner and with as little pain as possible is very important for our athletes and for our patients who are recovering from an ankle injury. One of the things we want to make sure we rule out is a fracture. So, getting an x-ray after an ankle injury to rule out a fracture of the ankle or a fracture of the bone of the foot is very important. I at one time, thought I rolled my ankle. Turns out I actually fractured my 5th net. So getting that x-ray is very important to help distinguish the severity of your injury. Again, shout out to Ja Morant. We wish and hope him a very speedy recovery from his grade 2 ankle sprain. And that's a lot and a ton of information about the ankles. Guys, if you want to learn anything more, if there's any more topics or athletes that you want us to cover, please make sure to follow the page, shoot us a like, subscribe to the YouTube page, and make sure to check out Fit Club NY for more health and fitness related content. Until next time, guys.